We had the issue last week Friday with 3 of our nationals from Grenada. They are being re-swabbed today, and we eagerly await those results, which I promised the Minister of Health of Grenada, with whom I spoke with this morning. He wants to have some idea of those results because there are implications for what is happening in Grenada.
Trinidad's Health Minister Terence Deyalsingh as he addressed the media on Monday morning. He made similar comments during a press briefing on Saturday as journalists quizzed him about the status of 3 of their nationals who visited Grenada in March and got stuck when the airport was closed as a result of the emergency regulations. They returned to Port of Spain last week, tested positive for COVID-19, which means that they went undetected while in Grenada. Grenada's health ministry labelled the news as disturbing. Minister Nicholas Steele told GBN they have been in contact with their peers in Trinidad and both sides have agreed to keep each other informed.
Trinidad's protocol is if you test positive, you stay in, regardless, you stay in 7 days quarantine, and at the end of the 7-day period, you are tested again. We have asked the Trinidad government to test them earlier to help us verify certain questions or queries that we may have, and I have the agreement of the CMO to do as best as possible to acquiesce.
Dr. Christine Carrington, Professor of Molecular Genetics and Virology at the University of the West Indies, has been explaining why some COVID patients go undetected.
There are some people who oscillate back and forth between negative and positive PCR results. Now, all tests have a limit of detection below which they won't detect their target even if it is present, resulting in a false negative result. Now, PCR tests are extremely sensitive, but if the level of virus in a patient sample is below the test threshold of detection, it will return a false negative result. Now, false negatives are most likely early on in an infection when the virus is only just beginning to replicate, so the levels are very low, and again late in an infection after the immune system has cleared the majority of the virus.
Dr. Carrington says there's also good reason why 2 similar test results must be had in succession to determine a patient's actual status.
During these times, very slight variations in virus levels or in test conditions can mean that on one day you don't detect the virus and the next day when you retest, you detect it. Again, this is why they wait until there are 2 consecutive negative tests before someone is discharged.
During Monday's press briefing, Minister Deyalsingh stressed that the global pandemic is not slowing down. He noted 3 countries in the million-case group, and these include the United States, Brazil, and India, with Russia close behind with more than 700,000 cases. Joseph Nikki Smith, GBN News.